Patients will often ask me, how long do breast implants last? Like any medical device, or any device for that matter, breast implants are subject to wear and tear over time. Implants are subject to leakage, and I tell patients that a breast implant will generally last them many years, although not forever. They are not lifelong devices. A breast implant generally has a leakage rate of about 1% per year. So at 10 years, a 10-year-old implant has about a 10% chance of leaking. At 20 years, approximately 20%. Obviously, the older the implant, the more subject it is to leakage and mechanical failure. It's important to consider changing a breast implant, but a lot of that depends on the type of implant that you have. For example, if you have a saline implant, which is a salt water filled implant, it's basically like a water balloon, so that if it leaks, it is simply going to deflate. The saline fluid that's in the implant will be absorbed by the body and will not harm you. The shell as well will not harm you, but obviously the implant will be deflated at that point. So detecting an implant leak with a saline implant is fairly straightforward. At that point, the implant would have to be replaced. If, on the other hand, you have a silicone implant, detecting a leak with a silicone implant is a little more challenging. So I like to tell patients who have silicone implants, obviously to monitor their implants, obtain their regular mammograms if they're of age to do that. And if they feel any kind of discrepancy or any kind of change in their position of their implants or anything that doesn't feel right, let us check you out. So I think it's important for a patient who has silicone implants to consider changing their implants somewhere between 10 and 12 years after they had the procedure, to be proactive in maintaining their breast health, maintaining the health of the implants, and allow them to avoid any problems that might develop after the fact.